Macular degeneration, the macula is a fancy Latin word meaning spot, and it's a central spot of vision in the back of the eye. It covers an area that may be 1/3 of an inch in size. And people, as they mature, the macula starts to degenerate because of poor blood supply to that area. And there are certain vitamins and minerals that a person can take that can prevent progressive macular degeneration. But it is not uncommon for people to develop abnormal blood vessels into their macula, end up bleeding into the center of vision. And then there are all sorts of treatments using lasers or injections of medications that can reverse these changes. Occasionally, patients need actual injections into the eye of a medication that will cause this disorder to go back towards normal. And although people think it's sort of frightening getting an injection in their eye, it was just 10, 20 years ago when people would end up with a hemorrhage in their eye and go blind and never return vision. While now we're having 80 to 90% people getting vision back because of this kind of treatment. Macular degeneration is mostly individuals that are over age 60, although there are some juvenile forms of macular degeneration. They usually run in families, and the families are aware of all the stuff going on. But the average person that we see with what's called age-related macular degeneration is just a person who is 60 or 65 or 70 that probably smoked when they were younger, and smoking happens to be a habit that causes constriction of the little blood vessels in the back of the eye. So they become a setup for developing poor blood supply and then hemorrhaging in their eye. Because what happens is if they have a poor blood supply, their body will develop new blood vessels to bypass that area. And it's the new blood vessels that are so fragile that will end up bleeding inside the eye. They expect that over 1/3 of the people over age 65 in the US will develop it. The most common symptom is that they get visual distortion. Like when you look at the edge of a picture on the wall or something like that, the line will be crooked or bent or twisted. The test that we usually do is we give patients like a piece of graph paper to take home, and they'll cover each eye separately and look at the graph paper and make sure the lines are smooth and straight. The first microscopic sign of macular degeneration is a distortion of the lines on the graph paper, and that's actually caused by clear blood plasma, clear fluid leaking into the retina. You imagine the retina is sort of like the film in the back of a camera. It's like getting drops of water in the film, and that creates the distortion. They found that 1-a-day multiple vitamins, and there's a series out on the marketplace, they're called AREDS. You can get them in Walmart or any other drugstore over the counter, and they're as a preventative to prevent age-related macular degeneration.